And now to your health. The Houston Health Department has identified 2 confirmed measles cases in adults who recently traveled internationally. These are the first cases reported in Houston since 2018. Dr. David Persse, the City of Houston's Chief Medical Officer, is joining me here today to share some essential tips with viewers about measles and the importance of vaccination to protect against this disease. Good morning, Dr. Persse.
Good morning, Haley. Thanks for having me.
So first of all, let's just remind people what measles is and why it's concerning.
So measles is a viral illness. It's common. Well, it's very uncommon in the United States. When I was a little boy, it was actually very common, and it causes, your illness, right? Fever, body aches. There's a rash that it causes. And for most folks, it's fine, but for pregnant women, for babies, and oddly enough, for adults who get measles, it can be really, really serious. So for most folks, it's fine, but for some folks, it's going to be a devastating illness.
Yeah, I know this is the first cases in adults since 2018 here in the Houston area. There was a case in Texas in 2023. That was in a child. What would be the symptoms if people need to be on the lookout for this? What would they notice in their kids or themselves?
Yeah, so you point out that it's very rare, and that's because we've had such great vaccination here in the United States. Now, measles is very common around the world, and these cases that we've had here in Houston, the previous case you talked about, were individuals who traveled internationally, they were unvaccinated, and they brought it back to the United States. Now, fortunately, it has not spread a whole lot because we have so much, immunity in the community. The symptoms to look for are a little bit challenging because the early on symptoms are very common. It's a headache, it's runny nose, it's burning red eyes. It's, a cough. But unfortunately, several days into the illness, you will then develop a very distinct rash. It's a red rash, it's red bumps. It starts generally on the head, and then it spreads down the rest of the body. That is characteristic for measles. Now, the problem is that you are infected and infectious for several days before that rash appears. And so you could be spreading it to family members where you only have very common, fever, cough, and watery eyes, which you wouldn't necessarily recognize as measles.
Yeah, I know that you've said that the vaccination is very effective. That's why we don't hear about this very often. But some parents are still hesitant to vaccinate their children. What would you say to those parents who have concerns?
Yeah, this is a great question, and I'm glad you asked it. So first of all, the measles vaccine, after you get its 2 doses, it's 97% effective. It is an extremely effective. Of all the vaccines we have, the measles, mumps, rubella vaccine, which first of all protects against 3 illnesses, is highly effective. And I understand that there's a lot of hesitancy now. And the thing to keep in mind is that this is a vaccine that's been around for many, many, many years. It has almost no problems. Now, there are some folks who will have some complications from it, just like anything that we do, right? Any medication you take, there's a risk of something. So let's put that in perspective. A recent 10-year study showed that per year, less than 20 people, these are generally children, less than 20 children will have a serious adverse effect amongst the tens of millions of American children who get vaccinated every year. So that's a small risk. And remember, there's nothing that is without risk. The other risk the parents could take would be don't allow your child to be vaccinated. And in the United States now, we have more and more parents who are considering not having their children be vaccinated. As that goes on, the risk of spread across the United States is going to go up. And I will tell you that I can remember when I was a child and lots of kids getting vaccinated, my parents, and in particular my grandparents, were frantic about it because so many children had such terrible consequences to the measles that they were thrilled when the vaccine came around. So, it's in the United States right now, it's safe because everybody participates. I fear that that's going to change. The risk from the vaccine is infinitesimally small, certainly compared to the risk should you contract measles.
Yeah, with actually getting measles. If you are living with somebody who is unvaccinated or have a small child, what steps should you take to protect them from getting the measles?
Well, first of all, if you're born and raised here in the United States, chances are pretty good that you've been vaccinated. But you might want to check with your healthcare provider if you can get a hold, depending on your age. Like somebody like me, it might be a little bit tough to get a hold of your pediatrician. But here in Texas, we have a thing called MTrack, where the state will help, if you signed up for it, will help track your immunizations. Find out if you've been vaccinated. If not, you can still get vaccinated. And again, if you think that you have symptoms, go to your healthcare provider. Tell them why you think you may have been exposed to somebody with measles, and you're not, you don't necessarily know what your vaccination status is, or you found out what it is, and talk to them, and they will. Remember, measles is preventable. We don't have it here in the United States, spreading person to person, because so many people have been vaccinated. We have basically, it only comes from international travel now.
Yeah, which is the 2 adults that are in Houston, right? They were traveling internationally.
That's right. They were traveling internationally, and they were both unvaccinated.
Very good information. All right, Dr. Persse, thank you so much. That is very helpful on this Monday morning. We hope you have a good rest of your day.